challenging, destructive, anti-therapeutic, defensive, regressive processes in group psychotherapy. One of my favorite topics, one of the most difficult things to work with your groups. I love this quote that the unseen enemy is always the most fearsome. So I think acknowledging and admitting that groups get off track, sometimes horribly off track. I think if you just look at the history of the world and people coming together to try to organize, you see endless conflict, wars, sadistic behavior, a lack of empathy. So when human beings come together, destruction is possible. So let's talk about what this can look like in kind of group psychotherapy. So much of the group literature really mainly explores kind of curative factors that contribute to positive outcomes. But the literature also attends the processes that kind of lead to treatment failures, limited success, and groups that go horribly off course. Psychotherapy groups offer many benefits and powerful moments of connection and meaning. However, it is important to appreciate that groups can also give rise to processes and dynamics that can disrupt their therapeutic aims and pose challenges even for the most experienced group therapists. While the literature is filled with wonderful case examples of deeply effective, affective, impactful work, all group leaders have experienced groups that struggle, get stuck, and eventually dissolve. So I like this quote by Ronnie Levine about these kind of processes in groups. And she describes a group that she was leading, and she said it this way. So rather than communicate their thoughts and feelings directly, members may avoid, block, exclude, excite, arouse, dismiss, attack, scapegoat, monopolize, dominate, direct, instruct, judge, withdraw, isolate, caretake, and collude with each other to keep themselves from addressing and containing uncomfortable feelings. Members can be intolerant of the intensity and the experience of primitive feelings. There's an inability to hold and contain feelings that leads to an unbearable experience of helplessness. Internal self-object relationships are triggered, and life histories are manifested in in-group reenactments. Levine here is talking about a group that has a lot of intensity, overwhelmed with their feelings, potentially has lost containment in some way, and doing the best they can just to survive moment in group, often going back to whatever survival strategies that they've learned or seen modeled in earlier pieces of their life. So I think all types of groups can experience this kind of flood of negativity. These kind of regressive feelings and defenses may be encouraged and may come to light more in kind of less structured groups. I'm thinking of Tavistock self-study groups, potentially some psychodynamic psychotherapy groups. But I think they also can occur in cognitive behavioral groups, psychoeducational groups. I think the challenge for the group therapist is to somehow kind of harness these forces in the service of work, in the service of doing group work. So Eaton kind of said it this way about cognitive behavioral groups, that there's ongoing processes or hidden agendas that arise spontaneously owing to idiosyncratic character or circumstances of the members, the eliciting quality of certain didactic material, the involving interactions among participants, and reactions both realistic and transferential, to the manner and sensitivity of the group leader's presentation style. Now, no amount of careful planning or captivating, colorful presentation can prevent dynamic group processes from arising. The leader's only choice is how and when to use the group process to support the educational aims of the group. To maximize learning opportunities, the group leader must attune to the stirrings within the group. Ongoing attention to the group processes allows for a kind of proper timing of your presentations, a selection of relevant information points, and a sensitivity to when it is advisable or even necessary to kind of interrupt processes and going back to educational material, or to interrupt the educational material in the service of ventilation, integration, assimilation, exploration, kind of renegotiation of what's occurring in the group. I'm guessing all of you have been parts of work groups that have, or family groups or friend groups that seem to have gone terribly off course, where people are no longer kind of communicating with one another, where a lot of negativity, aggression are being brought forth, and not much connection or productive kind of movement forward towards any kind of goal is being achieved. So I think one of the founding people who examined and kind of brought to light the destructive potential of group, I think, is Wilfred Bion. So he had this idea that there was two groups happening simultaneously. Kind of, we heard about Ronnie Levine's kind of progressive and regressive groups. He felt there was a task work group being productive, and then there was a basic assumptions group. So let's talk a little bit about basic assumptions groups. I think I've covered this earlier, but I think you'll hear this a lot as you talk about your groups with various supervisors and in your internship and practicum. So the basic assumption of fight-flight kind of refers to an as-if mentality, where the group members behave as if the task of the group were to identify and then fight off or flee from an enemy. So this enemy can be the leader, it can be the group as a whole, it could be an individual member like a scapegoat, it could be the help-rejecting complainer, it could be the person with too many feelings, it could be the person with not enough feelings. But in some way they either want to kind of destroy this bad object or get away from this bad object. So this is kind of the fight-flight basic assumption that occurs in many, many groups. The second basic assumption, although they're not always put in order, would be the dependency group. This often manifests in early stages of group formation. The group acts as if its goal is to obtain total security for all its members. In this position, the group wishes to be looked after, protected, and sustained by an idealized, omnipotent leader who will care for their every need, every whim. So when frustrated by the leader's eventual inability to gratify all these dependency needs, the group may fall into a counter-dependency mode, which will become much more aggressive, dismissive, uncooperative, perhaps into kind of a fight-flight state that we covered earlier. The last one that Bion talked about is the basic assumption of pairing. This is where two members kind of take the focus in the group while everyone else becomes more passive. This kind of identified couple could be two members, it could be a member and a leader, it could even be co-leaders potentially. The understanding here is that the group kind of develops a messianic fantasy that this couple will somehow miraculously or magically save the group, preserving its integrity and identity, and kind of help move it towards a deeper level of healing. Even if the leader tries to broaden the dynamics to bring in other people into the conversation, the group will continually move back to this pair in some way. So this was kind of seen as the basic assumption dynamics in group, as opposed to the more rationally task-oriented, sophisticated work groups in which members kind of recognize they're interdependent, they are autonomous individuals, they kind of participate in the task relevant skills to achieve the goals of the group. They can kind of differentiate into different kind of roles in the group, sometimes taking a leadership role, sometimes taking the role of vulnerability or the role of sharing, sometimes a role of exploring or giving feedback. So this would be the sophisticated group as opposed to the basic assumption group that's horribly off task. So let's talk about this kind of struggle in being a group member between an independent self and an interdependent self, and then kind of a loss of a self. So I think group processes can kind of be viewed as a kind of an oscillation between a group as a whole and the individual. And you could put subgroups in there. So I think there's a desire here for people to be included in the group, and I think simultaneously there may be a fear against kind of being swallowed by the group and losing one's independence, individuality, one's uniqueness. Now, this can happen in group kind of distorted views of cohesion versus rebellion. I think in one way, people want to have this oceanic bliss, this merger with others, this loss of self. On the other hand, they also kind of want to have independence, their own views, connecting with others in their own unique ways. So Hopper called this the basic assumption, the fourth basic assumption, incohesion, aggregation, massification. So massification refers to group formation where a sense of a differentiated self is lost, and the experience of kind of merger fusion is kind of takes hold of the group in some way. In such a group, there will be no new ideas presented, there'll be no individual viewpoints presented. It will be all about staying in kind of this state of merger, and a promotion of individuality doesn't come forth. I think on the other side of this is kind of a fierce commitment to individuality, isolation, refusal to connect with other members. And I think group brings forth stronger feelings, or potentially highlights more distal feelings inside of people. So you can see, while we may each carry these internal dilemma of wanting to be close and being scared of being close and not wanting to be swallowed up, in group this can take on a much stronger intensity. So let's stop there for now, and let's talk about some other ideas about destructive processes in group psychotherapy.